Our first week of the new year in the same pandemic. More questions coming up each day about the vaccine, what happens next, and when we'll get back to normal. Tonight in our coronavirus special, we're getting answers. Everything from when and where you get vaccinated to the changes being made in other departments in the hospital. Every week we present you this conversation in hopes of moving forward. We Together, a coronavirus special.
And thank you for joining us tonight for our special. I'm Molly Pat. I'm joined by two experts in this pandemic from Stormont Vail Health. Dr. Sri Donapudi is here with us again, and Dr. Kimberly Bry, who is an OBGYN and medical staff president. So thank you both for joining us tonight. We do only have about 25 minutes here, a lot of questions to get to, so I want to give a quick update on the latest numbers and trends that we're seeing right at this minute. First, so look at the numbers in Kansas. More than 233,000 people in the state have tested positive since the pandemic started. Nearly 2,900 of those people in the state have died from the virus, and right now more than 800 people are in the hospital fighting the virus in Kansas. Now looking at the latest coronavirus headlines now. First, leaders in Japan are considering declaring a state of emergency in the Tokyo area. This comes as the number of coronavirus patients in 4 jurisdictions, including Tokyo, account for about half of the nationwide total. Plus, as of this weekend, only 4.2 million people have actually gotten the shot in the U.S., despite the promise of 20 million doses being administered before 2021. And that's been our most asked question. Why is the vaccine rollout moving so slow in Kansas? And we've been asking the same questions. The federal government's most recent numbers show that the state has received 131,000 vaccines, but only 20,000 people have gotten their first dose. So just today, we asked the governor about what's taking so long. And she says that it's actually just slow reporting, not slow distribution. Take a listen.
We are getting vaccines into people's arms at a good clip. We get a limited amount from the feds, so whatever we're getting down into our local communities and into people's arms. In fact, I think Kansas has probably one of the most efficient systems set up.
So Governor Kelly says that not all providers are trained in how to report how many vaccines are going out into a computer system. She says that needs to be improved. The state health department says vaccines have gone out to all 105 counties. They hope to have a better idea of what the numbers are later this week. So nearly all of our viewer questions that we've been receiving are about the vaccine. Dr. Donapudi, first on that note, where are we with distribution for healthcare workers at Stormont? Those who got the first round should be coming close to their second shot here soon, and then what other employees are getting in line now?
You've got it, Molly. We're starting our second round of the Pfizer vaccines starting on Wednesday, and we'll be doing that through the beginning of next week, getting through the second doses for the Pfizer vaccine. We did receive some doses of Moderna for our remaining staff that had not received the first vaccinations. And so we're in the process of pushing out those invitations to folks now and trying to encourage folks to not put it off as we move out of healthcare workers, ultimately as we continue this work and complete our vaccination of our own team members who are ready to receive the vaccine. We'll be able to cascade to other priority groups.
And were we just waiting on that other shipment? Is that why healthcare workers are still getting the shot? Has the process been slower or faster than anticipated for rollout?
So the first doses from KDHE to healthcare workers, I think, were centralized mostly around the healthcare systems across the state. So we were one of those systems who were able to start that process earlier. In this first group of priority, long-term care is also included in that, and so a lot of the allocation after that first allocation, a lot of those subsequent allocations from Pfizer were routed directly to CVS and Walgreens, who are handling the long-term care administrations for those residents and the staff at the long-term care facilities. And the health department and Grace Med are just now getting their supplies to be able to deploy to the community healthcare providers who aren't employed by a health system.
And so are you hoping that kind of, speeds up, puts a little pressure on the process to move things a little bit quicker?
Ultimately, I think, at least for us, as soon as that vaccine has gotten into our hands, we're getting it all out within 5 to 7 days. So we're not sitting on any vaccine that we're receiving. So we're moving it as quickly as we can. But I know the health department had some planning to do to get the vaccine that they received last week, and gather the information from the community health care providers to be able to deploy that. And on the note, between the, you get it and you're giving it out in 5 to 7 days, is there a expiration date on those vaccines? So it depends. There's differences between the Pfizer and Moderna in that regard, and how long they are stable, especially once they've come to, once they've thawed, once they've come to kind of a refrigeration temp. And once the Pfizer vaccine has come to that temp, that's the shortest shelf life that we deal with. The Pfizer vaccine is 5 days once it's come to refrigeration temp that we have to use it. Once it's been mixed, you don't have the mixing with the Moderna vaccines, but with the Pfizer vaccine and the Moderna vaccine, once they're actually, the vial has been punctured and started in terms of drawing up the vaccine, you have 6 hours in which to use that vial before it's gone. Yeah, so you really do kind of have to move fast. Dr. Bry, I didn't forget about you, so as an OBGYN, can you talk about where pregnant women or those who are trying to be will be in line for getting the shot?
They're wherever they are in their station. So if they are nurses, then they're in line with healthcare workers. If they are in long-term care facilities, they're going to be in line with them. So wherever they are in their station, they'll definitely be in line. They are not forgotten during the system, and they definitely are able to get the vaccine. So.
Yeah, I think that's one thing that people have been on the fence about. Is it safe for pregnant women to get the vaccine?
The pregnancy was not studied. But our colleges, our governing boards, ACOG and the maternal fetal medicine governing boards are saying that you should have a discussion, an individual discussion with your physician. It depends on your risks. It depends on the risks of your contracting the illness. It depends on the risks of your own healthcare problems and your individual needs. So you should have that discussion with your physician.
Yeah, so if you're pregnant, it really is a case-by-case, person-by-person basis.
Absolutely.
Okay. Dr. Donapudi, this question comes from Doug Peterson. He's asking how the public will be notified when it's their turn to get vaccinated. For example, he says, I'm 67 years old and healthy. How will I be notified that I'm eligible to be vaccinated? Now, important here, Doug isn't the only one asking this question. We had dozens and dozens of people ask this, and how will they know? Is there a notification? Is it the honor system? What guidance are you getting from the state?
Yeah, I totally understand the eagerness to understand how that process is going to work. And at this point, I don't have specific logistics regarding how that's going to be deployed. I'm not even quite certain at this point whether that allocation will be managed and directed by the health department, by Grace Med, distributed amongst us in the community to be able to get out to the community. So we'll definitely be working together as we get guidance from KDHE to get it out there. And I know for us, we'll leverage every communication channel that we have, including you guys and all our media channels, to be able to get that word out to the public.
And so you all will probably be trained on the system to alert people and then also to report, that vaccinations are rolling out. We know that Kansas has been reported as one of the slowest states, so that's probably in that communication system as well.
Yeah, that's a little bit of a peculiarity, and I know that they're looking into whether there's an issue with Vaccine Finder is one of the systems that we use to electronically kind of track who has those doses and as they're being utilized and administered. And as I said, for us, it's within 5 to 7 days of receipt, and I know that the other health systems that have received vaccine are working to utilize their supply very quickly as well. So it doesn't really make a whole lot of sense, at least based on all the conversations that we've been having with KDHE regarding the vaccine supplies that have been deployed, that those haven't gone out to the community. So I think they're looking into whether there's an issue with the tracking system that's not syncing up.
Okay. And Dr. Bry, are there concerns about women who are pregnant and get coronavirus, and what does that look like for somebody who is pregnant and does have COVID-19?
Yeah, there's always concerns. Anytime you have an infection in pregnancies, there are concerns. COVID-19 is not any higher risk at getting it, but it is definitely a concern once you get it in pregnancy. You are at a higher risk of having a more severe disease. We have specific rooms that we separate patients for COVID-19 in pregnancy. Especially if you're in labor. We will put you in a negative airflow room. I'm sure you've heard of that on the news several times over the last 8 months. The negative airflow rooms is where you'll labor and you have your baby. We encourage all of the same things that you continue to have even when you don't have COVID-19. So you continue to have skin to skin. We encourage breastfeeding. We do all of those same things. We are following the American Academy of Pediatrics guidelines that are encouraging those things, and there's no need to separate any babies from their parents, and we want to continue to encourage that.
Yeah, learning together and making arrangements, that's the key here. All right, we're going to take a quick break, but when we come back, we're going to talk more about precautions when it comes to having a baby at Stormont Vail in the pandemic, and of course, more vaccine questions are straight ahead.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
We really are doing something that we love, and that's making people happy.
For every customer that steps through these doors, we want to create the best car buying experience out there.
Because that's how we've always done it.
And that's how we'll continue driving forward.
Modern art for the road. The 2020 Arteon. Get $7,000 off MSRP on in-stock models. There are 0 reasons not to get into a new Volkswagen during our biggest event of the year. Sign, then drive. Crown Volkswagen, 3400 South Iowa, Lawrence, Kansas.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
The Jefferson Awards, sponsored by Azura Credit Union. To nominate a volunteer, go to KSNT.com.
Welcome back to our coronavirus special discussion tonight. Dr. Bry, I want you to talk about what sets you all apart for having a baby at Stormont, especially during the pandemic. Obviously, things are different.
Not much has actually changed, at least not as much as you think. We, of course, are wearing all of the normal protective equipment that everybody is supposed to wear, the masks, the shields, sometimes gowns. We have all of the normal interventions that that normal hospitals have. We have more than 50 certified nurses, though. I think that's a big thing. The hospital in general is magnet certified, and having more than 50 certified nurses on our unit in the NICU and birthplace sets us apart. It definitely helps with managing of low intervention. It gives patients many options to help with different settings, using the whirlpool, options for pain management that aren't epidural, and IV pain management and epidurals, and we still have those other options, but we have all those other alternatives too. We allow patients to move around. We have position changes that also help with labor management and things. And so we really encourage those things, and the pandemic hasn't really changed those. We really encourage all of that all the way around.
Yeah, that's great to hear. Just stay calm with everything. Yep. Yeah. Dr. Donapudi, I always like to check in. How is capacity, staff, and equipment looking at the hospital right now?
We're doing okay. It's day by day. I know that the ED got pretty backed up several times over the course of this last few weeks. Our COVID-specific census had kind of stabilized around the 60s range, and that's crept up over the last few days as the positive testing rate has been creeping up as well. So that's a little bit worrisome in terms of a harbinger for post-Christmas and whether we're going to see a significant uptick again.
Yeah, and another viewer question about the vaccine, Susan, she asked what happens if the second shot isn't available when it's due for somebody. So obviously we have a lot of healthcare workers coming up on their second dose. If you miss that second dose, you have to start the whole process over again. What does that look like?
So two answers to your question. The first one, that second dose is really a reserved allocation from the government. And when I say that, what that means is basically once we have given you a first dose, there is a second dose that's been set aside for you by the government and the state. So we can secure and be certain of having the availability of that second dose to be able to give you within that required window. Your second question. Sorry, lost it.
If you miss the second dose, you have to start the whole process.
Yes. So they give us a little bit of a grace period in terms of, so Pfizer, their recommended window is at 21 days for that second dose, and for Moderna it's 28. And we have a bit of a grace period with both of those that you can give it as much as 4 days before that. After that is the little bit of hazy part. And I say that because in the Pfizer studies, they excluded anyone from the study who did not receive that second dose within 42 days, I believe it was. So we don't have data for folks who at least surpassed that point. But if you are late getting that second dose, there is no recommendation to repeat the first dose. It's to just get that second dose as soon as you can, as soon as it's available to you.
Okay, but easing concerns. Once you get that first dose, there is a second one already set aside for you.
You got it, Molly.
Dr. Bry, you know, the medical community has been a champion of the vaccine. So can you talk about, since these have started to roll out, how is morale doing? How is positivity? How are you keeping your staff going in the pandemic?
I think morale has improved dramatically. I think, I mean, not only in our hospital, but other hospitals, I've seen it on Facebook. The morale is improved. People are very excited to have the vaccine. You've seen all the pictures of people getting the vaccine. I think that this is a positive movement.
All right, great. Well, we're going to take another quick break here, but we do have more questions to be answered, so we will be right back after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Hi, I'm Bob Goodall from Kansas Furniture Mart.
Price guaranteed. Ashley's Darcy sofa in 9 colors, $288.
Financing for everyone at the original Kansas Furniture Mart.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Ladies, I'm ready!
Tonight.
The only thing that I'm missing is someone to share life with. We gotta find out who Miss James is. It's not gonna be easy.
The magnificent journey begins.
I've been training for this my whole life. I felt that instant chemistry.
It feels really good to say that I'm falling in love with somebody.
We're going to war.
And this season, the drama will be unmatched.
I'm cracking.
You okay?
No, I'm not.
The Bachelor premieres tonight, 8/7 Central on ABC.
Frontliners, essential employees, Heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
Hi, I'm Bob Goodall from Kansas Furniture Mart. Queen Pillow Top Mattresses, $133, 8-piece living room groups, $888. Financing for everyone at the original Kansas Furniture Mart.
All right, we are back for our final segment in tonight's coronavirus special. So, Dr. Donapudi, of course, more vaccine questions. So, is the coronavirus vaccine going to become a requirement at the hospital once it's widespread? I know people were talking about that online. What does that look like?
So, not anytime soon. So, I think the first part of what you said, it needing to be widespread and widely available, is really kind of a prerequisite to really being able to even talk about any kind of requirement. The other piece is, because it's still under an emergency use authorization, the CDC really kind of discourages systems from making it a requirement at this point until we have kind of the fuller FDA approval behind it, as they've gathered more information.
Yeah, and can you talk about flu season? Is there going to be a flu this year? Are we going to be seeing a mixture of a bunch of different viruses this winter? What does that look like?
That's a great question, and normally by this time of year we would already have a significant proportion of flu that we'd be seeing both in our outpatient and our inpatient location. And this year I believe we've had one inpatient so far for flu, so the preventative measures that folks are taking in not, being out and about as much and wearing masks and washing hands are definitely impacting the flu transmission. And that's something that we're kind of actually seeing all over the world, that the flu numbers really are not where they typically are this time of year. So if folks hold to those precautions and measures, I expect that we'll continue to see some impact, but I would not be surprised if we do start to see a little bit more flu as the winter progresses here.
Yeah, so at the beginning, we were all asking, are the masks, the extra hand washing, the socially distance going to help us from the flu? I mean, at this time, usually we are well into flu season, so do you truly think that it is all of the precautions?
I absolutely do. Yes.
And so is there, are you guys expecting a surge later on in the winter of the flu, or kind of how are you going to separate the two?
So I think it's a little bit of an unknown whether, as people may not be as diligent, or just due to the breakthrough of the virus, that we may start to see more flu later in the season. But I think if people continue the rigor around their efforts, that will at least stem any significant volume of flu that we see, but remains to be seen for sure.
Is it possible that the flu virus might not even be a thing this year at all?
It is possible.
Yeah.
It is possible.
Oh, that's interesting, because usually that is all we're talking about right about now. Okay, Dr. Bry, let's talk about protecting yourself as a pregnant woman, or if you have a newborn, from the pandemic, along with all of the other viruses this winter, potentially the flu. Any advice on that one as we get into the thick of winter?
Well, I think most of it is the same thing that we tell everybody. Mostly it's wear your mask, wear a shield, wash your hands, stay away from people. With a newborn, you should probably stay home more. You shouldn't take your child around big groups. You shouldn't be around big groups anyways. Staying at home is what needs to happen right now, and that way we can stay away from this and keep everybody healthy. So it's the same things that the CDC is telling all of us to do.
And some people might be concerned about newborns and infants, a little bit harder to protect because you obviously can't put a mask on them and whatnot. Any advice for new moms who might be concerned about that?
Keeping them away from anybody that's sick. That's the biggest thing. And again, staying away from sick contacts and washing the mother's hands, them staying away from people that are sick as much as they possibly can, them being diligent about wearing their mask, and keeping everything the way that the CDC is recommending at this point.
Dr. Donapudi, when do you think that we will be in that widespread vaccination period? I know it's hard to answer, but what is going to really trigger that to move us on into the next phase? Do you guys contact the health department and say, okay, all of our healthcare workers are vaccinated, we can keep moving forward? Because I think people are really looking for a timeline to feel like they can look forward to being normal again.
Totally understand. I mean, that makes perfect sense. And right now, KDHE is updating their guidance with respect to the priority groups and how we will cascade through them. Again, right now the focus is healthcare workers and long-term care facilities, and we're nearing a point where the healthcare systems have gotten what they needed for their team members who are ready and willing to receive the vaccine, but we're just scratching the surface in a lot of our communities in getting the vaccine to the healthcare providers in our communities. And that does include dentists and pharmacists and pharmacy workers, school health nurses. So it's a pretty broad group of folks. Early on, the guidance from CDC was that the next group would be essential workers, which would include groups like teachers, fire, police. So I think that's one of the things that KDHE is looking at in terms of not only vetting who exactly the priority groups will be and how we will cascade through them, but also who is included in each of those groups. The current national projections are that it will likely be spring and possibly early summer by the time we're really able to get out into the general public. Hoping it'll be sooner, but that's the projections that we have right now.
Yeah, and so we know that the Stormont Vail Event Center has been turned into a vaccination site, really than an event center. Are you guys going to be using that to vaccinate the public, or is that not decided yet?
So that is our hope, but it will be dependent on a lot of things. One is KDHE's direction as well as the collaboration with the health department and Grace Med. I expect that we will leverage it for that. That is certainly why we pursued it and stood it up. We could have handled just our team members in a more less expensive and a more efficient fashion. So, but we really wanted to be able to stand up that service to be able to serve the broader community need.
And Dr. Bry, when do you think that it would be, you know, if a pregnant woman decides, I don't want to get the vaccine while I'm pregnant, how long should they wait? Is there any guidance on that that you can weigh in on?
Breastfeeding is the same as pregnancy. There wasn't any studies during the initial trials. It's a discussion to have. Theoretically, there's low risks, but it's a discussion to be had with your pediatrician, with your physician, and depending on your risks individually.
Okay, and so I want to end tonight by asking both of you if there's anything that we might not have touched on yet that you think is really crucial for people to know. So Dr. Bry, I'll have you start.
Okay, I think it's really important to know that it's safe to have a baby in the hospital in Stormont Vail. It's actually much safer in Stormont Vail and in the hospital to stay away from COVID, and we are keeping babies together. We are keeping the baby and the mom together. We are keeping families together. Your support person is allowed in the room with you and will stay in the room with you. And we are encouraging skin to skin and breastfeeding. All of those things are very important to us, and will stay that important to us, and we are having that encouraged. So.
Yes. Dr. Donapudi, about 25 seconds for you.
Two things that I think is really important that I don't think that we've talked about as much. Making sure when you have the vaccine available, we've had lots of questions about that tonight, take it. Please take it. More than 50% of people, even 8 weeks out from an actual infection, still have symptoms that are impacting their life. The other thing that I think it's important to highlight that I don't think has really been a large part of discussion is that the studies, both for Pfizer and Moderna, did include broad racial groups and similar effectiveness.
All right, thank you both so much for joining us tonight. If you have a question, let us know. Thanks for watching.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.